Bonjour and good afternoon to everyone. Today I'd like to reflect on the trend of the pandemic and the perseverance of Canadians. Starting with the numbers update, there have been 117,031 cases of COVID-19 in Canada, including 8,947 deaths. 87% of people have now recovered, and labs across Canada have tested over 4,178,000 people for COVID-19 to date. Over the past week, an average of 46,283 people were tested daily, with 1% testing positive. Based on the most recent 7 days, there have been an average of 347 cases reported daily from across the country. As some jurisdictions haven't reported new cases over the weekend, we can expect this to go up as the weekend numbers come in later today. And this is why we've been looking at the 7-day average instead of just relying on the daily numbers. Beyond the numbers, my deeper long weekend reflection was on the concerning global trend of the COVID-19 pandemic and how we can maintain our perseverance against this ongoing threat to our health and society. Canadians have made many sacrifices, and I want to say how thankful I am to the great majority who continue to follow public health practices as the evidence evolved, including the wearing of non-medical masks or facial coverings in indoor public spaces and when physical distancing is difficult to maintain. I know these adaptations have been difficult, and the uncertainties of an emerging disease event on this scale have been stressful, to say the least. In this situation, the stakes are very high, and it is more important than ever that we take an approach that is informed by the best available science and evidence. While some decisions have to be made when the evidence is incomplete, we must remain open to all lines of inquiry, carefully gather the evidence, and adapt and change our approaches as the science evolves. For some people, the change won't be quick enough. For others, it will be too quick or not convincing enough. Everyone will have questions, some more than others. It is perfectly acceptable to have questions, and no question should be considered silly or wrong. Questions are healthy. They challenge us to think things over from all perspectives and to thereby reach a solid conclusion that can stand up to healthy scrutiny. In fact, we all need to scrutinize when we read, listen, and share information. It is no secret that there is a lot of misinformation swirling about. Following the wrong lead can be distracting and harmful. Every one of us has a role in making sure our sights and energies are focused on the right path. When information comes to us, we need to critically evaluate, check against credible sources, and not share further if there is any doubt as to its validity. Sometimes, the best guide is a simple one. Here's one that I have referred to before, most often attributed to the 13th century Persian poet Rumi. It's known as the 3 gates of speech. Before you speak, let your words pass through 3 gates. At the first gate, ask yourself, is it true? At the second gate, ask, is it necessary? And then the third gate, ask, is it kind? We've got a long road ahead, so don't lose hope, stay the course, and keep being part of the solution. Donc, ensemble, gardons le cap. Merci.
Let's keep it together. Thank you.
Bonjour. Aujourd'hui, nous aimerions discuter de la tendance dans les données sur la pandémie et de la persévérance des Canadiens. Commençons par la mise à jour des chiffres. Il y a eu 117 031 cas de COVID-19 au Canada, dont 8 947 décès. 87% des personnes se sont rétablies. À ce jour, les laboratoires de partout au Canada ont fait l'analyse de plus de 4 178 000 tests de dépistage de la COVID-19. Au cours de la dernière semaine, 46 283 personnes en moyenne par jour ont subi un test de dépistage, dont 1% ont obtenu un résultat positif. Selon les données des 7 derniers jours, une moyenne de 347 cas ont été signalés chaque jour dans l'ensemble du pays. Comme certaines administrations n'ont pas signalé de nouveaux cas au cours de la fin de semaine, nous pouvons nous attendre à ce que le nombre de cas augmente lorsque les chiffres de la fin de semaine nous seront communiqués plus tard aujourd'hui. C'est pourquoi nous examinons la moyenne sur 7 jours au lieu de nous fier uniquement aux chiffres quotidiens. Mais au-delà des chiffres, au cours de la longue fin de semaine, nous nous sommes plongés dans une réflexion approfondie sur la tendance mondiale préoccupante de la pandémie de COVID-19 et sur la façon dont nous pouvons continuer de persévérer sous cette menace constante pour notre santé et notre société. Les Canadiens ont fait de nombreux sacrifices et nous tenons à exprimer notre grande reconnaissance envers la grande majorité d'entre eux qui ont continué de respecter les directives de santé publique à mesure que nous prenons connaissance des nouvelles données probantes, y compris de porter un masque non médical ou un couvre-visage dans les espaces publics intérieurs et lorsqu'il est difficile de garder une distance physique des autres. Nous savons que ces adaptations ont été difficiles et que les incertitudes d'une maladie émergente de cette envergure ont été stressantes pour le moins qu'on puisse dire. Dans cette situation, les enjeux sont très élevés et il est plus important que jamais d'adopter une approche fondée sur les meilleures données scientifiques et probantes disponibles. Même si certaines décisions doivent être prises dans des situations où les données probantes scientifiques sont incomplètes, nous devons demeurer ouverts à tous les domaines de recherche, recueillir soigneusement les données probantes et finalement adapter et modifier nos approches à mesure que la science évolue. Pour certaines personnes, le changement n'arrive jamais assez vite. Pour d'autres, il est trop rapide ou pas assez convaincant. Tout le monde aura des questions et certaines personnes en auront plus que d'autres. Il est tout à fait acceptable d'avoir des questions et aucune d'entre elles ne devrait être considérée comme bête ou inacceptable. Il est sain de poser des questions car elles nous poussent à réfléchir à tous les points de vue et à en arriver à une conclusion solide qui résiste à un examen approfondi. En fait, nous devons tous faire preuve de vigilance quand nous lisons, entendons et diffusons de l'information. Tout le monde sait qu'il y a beaucoup de désinformation. Le fait de suivre une piste mal avisée peut être une source de distraction et peut causer du tort. Chacun d'entre nous avons un rôle à jouer pour nous assurer que nos points de mire, nos énergies sont concentrées à la bonne place. Nous devons évaluer de façon critique chaque information que nous recevons. Il faut ensuite vérifier sa validité auprès des sources crédibles et éviter de la diffuser si nous avons des doutes. Parfois, la meilleure marche à suivre est simple. Et voici une que nous avons déjà évoquée, le plus souvent attribuée à Rumi, un poète persan du XIIIe siècle. Elle est connue sous le nom de « Trois portes de la parole ». Avant de prononcer des paroles, il faut qu'il franchisse trois portes. À la première porte, il faut se demander « Est-ce vrai ?» À la deuxième porte, il faut se demander, est-ce nécessaire? À la troisième porte, il faut se demander, est-ce aimable? Nous avons encore beaucoup à faire. Garder l'espoir, garder le cap et continuer de faire partie de la solution. Merci.
Thank you, doctors. We will now open the phone line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics. Operator, over to you for the first question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, veuillez appuyer sur étoile 1 maintenant pour poser une question. The first question is from Mia Rapson from the Canadian Press. Please go ahead.
Yes, good afternoon. I'm wondering, Dr. Tam, there's a lot of hope being placed in the vaccine, and we've seen some reports of positive results from some vaccine trials. They're in phase 3. But there also seems to be a lot of people who think once that vaccine is approved, that this pandemic will be over. And I'm wondering if you could speak to that. What happens once that vaccine is approved, and how realistic it is for a timeline for us to be able to return to a much more normal life once we get a vaccine?
Thank you. That's a really important question. And I think it is amazing that the world has come together and there are so many vaccine candidates that's being evaluated And some, as you say, there's been several of them that have initiated what we call phase 3 clinical trials. And these are much larger than initial phase 1 and 2 trials, where smaller numbers of people have been vaccinated to look at safety and to look at the immune response, for example. In these phase 3 trials, what the clinical trials objectives are looking at, of course, are safety profiles, which are very important, and then looking at the efficacy or the effectiveness of the vaccine. We call efficacy when it's in phase 3 trials. So you're looking at tens of thousands of people as opposed to a smaller number or a few hundred people, for example. So we will be able to then characterize the vaccine's effects on the immune system a bit more in depth, and looking at a broader range of potential adverse events. And it still will be outstanding questions even after phase 3 trials on the degree and the duration of the immunity. How many doses of vaccine do we need? Do we need a booster later on? Some of it, the success of the vaccination program will also depend on how the virus is undergoing evolution. Would it change? Would the current vaccine need to be adapted if the virus should change? So there's quite a lot of unknown questions. But what we will see is that as phase 3 trials get underway, we will have much more information to go on in terms of the next stage, which is scaling up the use of the vaccine in the wider population. And even at that stage, we need to monitor very carefully the effectiveness, but also the safety when it's being administered to a bigger population. So all to say is that we have to use all avenues to try and get a vaccine or even more than one vaccine for the Canadian population. But really, honestly, we don't know at this stage whether the vaccine, how effective the vaccine is going to be, whether it prevents serious illness and hospitalizations. Does it prevent you actually getting an infection? Because some vaccines, influenza vaccines, for example, prevents you from maybe serious outcomes, but doesn't necessarily prevent you from getting the infection altogether. So these questions remain unknown. So I would say that vaccine is a very important aspect of the response going forwards, but we can't at this stage just put all of our focus on in the hopes that this is the silver bullet solution. It is a very important solution if we get a safe and effective vaccine. But I would say that the public health measures that we have in place, the sort of personal, daily measures that we take, is going to have to continue. And quite honestly, a lot of it is good personal hygienic practices that we should sustain in the long run anyways. So I think in terms of timelines, a lot of the companies looking at phase 3 clinical trials are really hoping that they'll get some results by the end of this year. Some of them are very ambitious. Some of them are saying, well, maybe the beginning of next year. But that still doesn't mean that we have vaccines for everyone. It's likely that there won't be enough vaccines for the population as the vaccine rolls out. So there'll be prioritization. They'll be looking at that. So I think we're in it. We're planning as a public health community that we're going to have to manage this pandemic, certainly over the next year, but certainly maybe planning for the longer term or the next 2 to 3 years, during which the vaccine may play a role, but we don't know yet. I would say that I do agree with Dr. Fauci in the United States that we can be cautiously optimistic, but not, it's one important layer of protection. We also don't understand, as I said, the immunity of the human body to the virus and the vaccine. So much needs to be learned. I'm taking a bit more time answering this question because I think it's worth, in the next while, for us to keep Canadians informed as to what's going on and what clinical trials mean. So thank you for the question.
Yeah, it's Dr. New. Maybe I just would add on to what Dr. Tam has said. She gave a very comprehensive answer. And I think the bottom line, I think, as the question was asked, is that, people might think that if we get a vaccine, then everything, quote, goes back to normal the way it was before. And that's not the case. As Dr. Tam and others have mentioned, a vaccine will not be a silver bullet. It'll certainly be an important tool. It'll be something that hopefully we can use to effective purpose for a large part of the population, or certainly certain vulnerable populations. But all of the measures we've put in place now will still have to continue with that new reality for quite some time. So certainly I think we need to temper people's expectations, thinking that the vaccine is going to be that silver bullet that will take care of everything, and everything we've done up to now won't be necessary in the future. Thank you.
Just wait 1 minute, Mia. We're going to repeat the answer in French, and then we'll proceed to your follow-up.
OK, oui, merci. OK, ça, on peut dire que tous les chercheurs à travers le monde, on travaille très fort pour développer un vaccin efficace pour que tout le monde, toute la population mondiale. Mais même si on trouve un vaccin, on dit en anglais, c'est pas comme la solution silver bullet, parce que c'est sûr qu'il y a toutes sortes des enjeux qui restent, même la distribution des vaccins. Et c'est sûr que la réalité qui existe va continuer avec toutes les mesures de santé publique. Il faut continuer à pratiquer toutes les bonnes mesures déjà éprouvées. Et le vaccin va être seulement un autre outil qui est disponible, mais ce n'est pas la solution complète.
Merci. Mia, follow-up?
Yeah, I'm also wondering, given that we've seen sort of the numbers bouncing around in some places that were low, and now we're seeing a bit of a surge in some places, do you have a threshold that you've set that in your mind, or even on paper somewhere, for when you would recommend that more severe lockdown measures be returned? Is there a case rate, an RT rate? Do you have anything like that you could tell people what they might look for to when that might happen, if that was to happen?
Yes, so the objective, and I think we've talked about some of this in our modeling or epidemiologic update sessions, is, of course, we're watching the trend, the laboratory percent positive that we are seeing in the test results. Right now it's low, with the overall 1% or positive rate. So if that's trending up, that is something of concern. In the Canadian context, we haven't set a specific trigger for that percent positivity, but we know that if it's trending up, it's moving towards 5%, we are taking sort of more, paying attention to that. At the beginning of the pandemic, the concept of a sort of 10% positivity rate as being in a sort of right range for both sensitivity of the system to detect and, determining if the virus is prevalent in your community was one concept. But we're sort of, I think, lowering that threshold to, 5% is a warning sign for sure. But there's lots of other contexts. We talked about this reproduction number, and we've been hovering around that one mark. Again, it's sort of looking at that trend. Right now, that R naught is less helpful when you've got small numbers bouncing around, so you'll see that erratically going up and down sometimes. But if overall that goes beyond 1 and continues to escalate, that's not a good sign. Some jurisdictions, for example, in Alberta, are monitoring and flagging communities that have a rate of illness of 50 per 100,000. So that's another threshold that communities or public health professionals have been watching for as well. But it's really a composite of everything. We know that ICU and hospitalization indicators are a late indication of disease spread, but nonetheless, it's also a very important marker for are you now hitting vulnerable populations? Not a good sign. So it's not one number, one specific trend, but a sort of composite look, and it's being watched very carefully. The other aspect to be watching for is your capacity to test, trace, follow up, quarantine, and isolate, because the concept right now is to keep this epidemic under control by having a public health system that can clamp down on every outbreak and every little fire that comes up. But if there's lots of them, which is not what we want to see, then the public health capacity to do that and must be monitored as well.
Thank you, Dr. Tam. Operator, next question on the line.
Thank you. The next question, la prochaine question est de François Carabin du journal Métro. À vous la parole.
Question from Metro.
Oui, bonjour. Merci de prendre ma question. J'aimerais parler du masque dans les écoles. C'est un sujet qui fait débat, notamment au Québec, en Ontario. En Ontario, on a décidé de l'imposer dès la 4e année. Au Québec, il n'y a pas d'imposition de masque pour l'instant. J'aimerais savoir quelle est la position de la santé publique du Canada. Est-ce que vous êtes en faveur du port du masque au primaire, au secondaire, ou pas du tout avant l'enseignement supérieur?
What is your position on this?
Wow, merci pour la question. Je pense que, premièrement, on peut dire qu'il n'y a pas vraiment comme une position de l'agence. On est tous ensemble ici avec nos homologues, les médecins hygiénistes de toutes les provinces et territoires. On est en train d'analyser toutes les données probantes scientifiques et les expériences dans les autres pays. Première chose, avant de discuter qu'est-ce qu'on fait dans les écoles, les choses les plus importantes, c'est quoi la transmission dans la communauté? On ne peut pas parler même de l'ouverture des écoles et qu'est-ce qu'on fait dans les écoles si, en effet, la transmission hors contrôle dans la communauté. Au Canada, on a fait un bon job, on a vraiment aplati la courbe et donc, c'est pourquoi on est arrivé à le point maintenant. On peut discuter qu'est-ce qu'on fait avec les écoles. Deuxième chose aussi, il y a vraiment un consensus qu'on sait qu'avec toutes les choses qu'on a fait pour contrôler la COVID-19, il y a toujours aussi des autres, comment dire, les conséquences inattendues. On sait qu'il y a des autres maladies chroniques aussi pour les enfants. Tous les experts nous disent qu'il y a des effets sur le développement mental et social pour les enfants. C'est très important qu'on considère l'ouverture des écoles. Ce n'est pas seulement peut-être faire l'éducation en ligne, parce que pour les jeunes enfants, c'est très important aussi pour le développement social, de jouer avec les amis, de rencontrer encore les autres étudiants à l'école. Donc, c'est pourquoi on est arrivé à ce point-là. Pour la COVID-19, on sait que toutes les mesures de santé publique éprouvées sont disponibles. Comme des couches de protection, de distanciation physique, la bonne hygiène pour se laver fréquemment les mains, aussi le porte de masque non médical au couvre-visage. Donc, je pense que c'est vraiment à l'échelle de toutes les provinces et territoires, et même à l'échelle locale pour les écoles. OK, qu'est-ce qu'on a comme l'infrastructure dans les écoles pour avoir la bonne disponibilité pour les étudiants, aussi les professeurs, les enseignants, pour assurer que tout le monde a un bon accès pour se laver les mains avec l'eau et savon. Ça, c'est la première chose. Pour la distanciation physique, ça, c'est déjà un peu, comment dire, pas si clair que... on peut dire une position spécifiquement. On sait que les enfants, en général, c'est sûr qu'ils peut-être la susceptibilité est peut-être pareille comme les adultes, mais il y a encore une question. Est-ce qu'ils peuvent transmettre les virus de même façon, avec la même efficacité, on peut dire, que les adultes? On sait, avec l'évidence, on a vu, moi, je vois que c'est sûr, peut-être après l'âge de 10 ans, que les enfants sont comme les adultes pour transmettre le virus. Et peut-être pour les enfants plus jeunes, moins que 10 ans, peut-être ce n'est pas la même situation. Donc, quand c'est possible, et c'est vraiment une décision pour vraiment, je pense, à l'échelle locale, aussi peut-être provinciale, qu'est-ce qu'on peut faire dans une école pour peut-être garder, comme c'est possible et pratique, garder une distance de 2 mètres. C'est presque impossible. Donc, je vois qu'il y a des autres options. Peut-être, je ne sais pas en français, mais peut-être garder un ensemble des enfants, un cohort, on dit en anglais, pour peut-être toute l'année scolaire. Ça, c'est une option. Et finalement, à part de ça, c'est la question des masques. Moi, ce que je vois avec l'expérience à travers le monde, aussi avec toutes les provinces et territoires, on considère que c'est vraiment important pour tous les enfants, plus que 10 ans. C'est comme les adultes. On sait qu'avec les données probantes, que c'est une mesure de santé publique efficace à l'échelle de la population de porter un couvre-visage. Donc, ce n'est pas un problème. Je pense que c'est seulement une question peut-être pour les enfants s'habituer, pas toucher les visages, tout ça. Pour les enfants moins que 10 ans, c'est quelque chose que toutes les provinces, je pense, sont en train encore d'analyser. Ils ont mis, comme on dit, une recommandation, une politique, on peut dire, dans quelques provinces. Et c'est quelque chose, on est en train encore de discuter, analyser. En effet, peut-être avec l'arrivée de l'année scolaire, c'était comme une expérience. On va voir au fur et à mesure qu'est-ce qui se passe actuellement dans les écoles. Mais une autre question que j'ai entendu, c'est OK, peut-être les jeunes enfants, ils ne sont pas capables de porter un masque. Ils vont fouiller avec le masque. Moi, je pense que on donne peut-être pas assez de crédit aux jeunes enfants. Je pense qu'avec l'enseignement, peut-être on commence peut-être même s'habituer pendant l'été, que ce n'est pas un enjeu de OK, ils sont capables ou pas capables. C'est vraiment une question, est-ce que ça peut aider à peut-être diminuer la transmission? Avec les données probantes jusqu'à date, ce n'est pas très clair. C'est pourquoi chaque province et territoire, je pense, en analysant les données, peut-être des options différentes, mais c'est ça ce qui existe maintenant avec les données. Merci.
Merci. Non, ça va, je n'ai pas de suivi. Merci beaucoup.
Thank you. No, I do not have a follow-up question.
So now turn to the room for a question.
Mike? No, please.
You go ahead.
No, please. Bonjour, Philippe Vincent Foisy de Radio-Canada.
Question from Philippe Vincent Foisy from
en personne.
Radio-Canada.
In person. Je viens d'écouter ce que vous dites sur les masques, mais je ne suis pas sûr de comprendre. Parce que j'entends, ça fonctionne, les masques, c'est efficace, que les enfants de 10 ans et plus peuvent transmettre le virus comme des adultes.
Plus que 10 ans.
C'est ça, 10 ans et plus, peuvent transmettre le virus comme des adultes. Donc, on a une solution qui est efficace à une population qui peut transmettre le virus comme des adultes, mais on n'utilise pas cette solution-là de mettre le masque comme on leur demande de faire, par exemple, dans un commerce. Parce qu'un enfant de 12 ans au Québec qui s'en va au magasin doit porter le masque. Donc, j'essaie juste de comprendre pourquoi vous ne dites pas ce serait bien, ce serait la meilleure solution. Après ça, les provinces prendront leurs décisions. Mais pourquoi vous ne dites pas ça fonctionne, c'est efficace, les enfants qui portent le masque à 10 ans peuvent transmettre la maladie, donc ce serait une bonne chose qu'ils portent le masque par mesure de précaution.
Oui, mais je pense, ce que je dis avec toutes les données scientifiques et probantes jusqu'à date, on voit une différence apparemment entre les jeunes enfants, moins que 10 ans, et les enfants plus de 10 ans. C'est pourquoi il y a peut-être un enjeu actuel à discuter même pour gérer dans toutes les provinces et territoires. C'est ça, je pense que c'est pourquoi les experts dans chaque province et territoire ont élaboré leur propre politique un peu en considérant les données, parce que c'est sûr que plus de scientifiques, on peut regarder les mêmes données et peut prendre peut-être des conclusions, des recommandations différentes. Moi, personnellement, je vois que, OK, avec ce que je vois avec les analyses, oui, que les enfants, plus que 10 ans, c'est vraiment comme les adultes pour transmettre tout ça. Et je pense que oui, je pense que c'est même la politique au Québec. Les enfants, à part de 12 ans ou 10 ans, c'est comme les adultes dans les espaces de l'intérieur, il faut porter un masque. Je pense que à l'école, je pense que le principe est pareil. Et je pense que c'est quelque chose... Peut-être poser la question, je pense que c'est une question, je ne sais pas, est-ce qu'il y a un âge exact pour dire, ah oui, c'est pas nécessaire ou c'est nécessaire. D'après moi, avec toutes les données, à date, on voit que peut-être les jeunes enfants, il n'y a pas beaucoup d'évidence qui peuvent vraiment transmettre le virus d'une façon efficace avec leurs amis, même avec les autres adultes. Donc, c'est aussi une question. Et l'autre affaire aussi, c'est, on sait pour les jeunes enfants, moi, je ne suis pas comme une experte dans l'éducation. C'est aussi une partie de l'éducation. Aussi, c'est aussi fait partie de, comment dire, les expressions du visage, tout ça, c'est fait pour mieux comprendre l'enseignant, articulation, pour aussi même apprendre à parler une langue. C'est des choses subtiles. Et si on porte un masque, ça peut être aussi une chose qui peut diminuer l'efficacité de ces autres aspects.
En suivi, j'ai une question sur le tourisme.
Le tourisme.
Il y a des compagnies aériennes, il y a des gens qui disent que le 14 jours de quarantaine obligatoire quand on vient au pays, ça nuit au tourisme, ça nuit à l'industrie, ça n'aide pas du tout la reprise. Est-ce qu'il y a un moyen quelconque dans les prochains mois, prochaines semaines, qu'on réduise ça, qu'on change ça avec le nombre de tests? Je ne sais pas, mais est-ce que vous voyez, dans un horizon à court terme, qu'on réduise ou qu'on diminue les restrictions pour ceux qui arrivent au Canada?
Oui, ce qu'on travaille actuellement, c'est avec l'état de la technologie, avec ce qu'on sait avec avec le virus. On sait que la limite pour la période d'incubation, c'est 14 jours. C'est tout le monde connaît maintenant le 14 jours pour la période d'incubation. Si on parle de nos frontières, le tourisme, c'est sûr, je peux utiliser comme une anecdote, je suis comme un trekkie en anglais. Malheureusement, on n'a pas comme un tricorder pour faire ça à tout le monde qui traverse la frontière. Ah oui, vous avez le virus? Non, c'est bon, vous pouvez passer. On n'est pas là. Mais c'est sûr, on continue avec les chercheurs à travailler, peut-être développer d'autres technologies pour même le dépistage. Mais on sait, on a déjà discuté plusieurs fois, c'est quoi l'état de le dépistage, comme on dit, le PCR. Ça prend quelques jours. Aussi, on a beaucoup comment dire, des chercheurs qui travaillent aussi avec les dépistages de points de service, mais c'est pas quelque chose qu'on peut utiliser maintenant. C'est pas fidèle. On peut avoir les résultats fiables, mais on ne sait jamais. On continue à travailler et à un moment donné, peut-être avec une combinaison de technologies aussi avec peut-être d'autres évidences scientifiques concernant le virus, ça peut changer. Mais pour l'instant, c'est la politique parce que c'est déjà éprouvé.
Merci, Dr. Next question in the room.
Hi, Michael Couture from Global National. Dr. Tam, I wanted to talk to you about the COVID Alert app. And what do you say to critics who say that the technology, because it is quite advanced, is limited in terms of its efficacy because it doesn't work on older phones? And oftentimes older phones are owned by elderly Canadians or lower income Canadians who are greatly affected by COVID-19.
Yes. So the COVID Alert app is a notification app, just to make sure other audiences understand this. So it alerts people in an anonymous way. If someone who's test positive puts a code in the phone, it'll alert people who have been in the proximity of that phone if they also have the app. So I have also heard some feedback over the weekend in terms of what you just said, which is older phones, perhaps past the sort of 5-year kind of newness. Is that a word? Older than the past 5 years, the app may not be compatible, and I'm not a technologist, so I think that has to go back to the Apple, Google, company for that particular indication. But just to sort of look at it from a public health perspective, you're right in that there could be people who don't have access to phones, who don't have a latest phone, who may not be able to use this. But I still think that it is as many people who can download it and use it as possible will make the app more successful. I'm actually thinking, in discussion with other medical officers of health, it may not be the sort of broadest coverage that you need, but what if you're in situations, for example, before you walked into a pub, before you walked into a nightclub, or other places where there could be a bunch of people that you may not know who's not in your specific social circle, where notification is particularly important. So maybe also targeting the application in certain settings and asking users to download it, who may in fact be the younger generation with the phones, is still, I think, very relevant for that setting. But I do think that this is something new, and as the application is being piloted and tested, some of these feedbacks will come back, which I think will be directed to the relevant people who can address that, which I can't do. But I still think, despite these gaps, we need to have a go at using it. And it may not have to be broad coverage everywhere, but certain settings that might be the exact settings that you want to use it in, workplaces or other areas where it is really helpful if people around you are notified without you having to, reach them, or public health having, really trying to catch people up as fast as they can. This might help them. So that's at least how I look at it. But I do think that if there are limitations, please send the questions in and they'll be directed to the right place, I think.
Just as a follow-up, I wanted to ask you then, so how do you propose reaching those people of lower incomes and older Canadians who may be falling through that technology gap? And B, in your suggestion of kind of a location-based thing, are you even exploring the possibility of a different app or a different notification system that may be applicable, as you said, to nightclubs, pubs, or bars?
Well, I think what I was thinking is that these are some of the discussions with other chief medical officers. That now they're asking people to, make sure you know your client list and keep it for a while. Well, this could actually be very useful. Use the COVID alert app. I'm not saying a new app, but that could actually be quite helpful if it's kind of difficult to keep, contact lists. But that's the kind of concept I think public health locally will provide these kind of directions to their businesses or these locations. But the COVID alert app might add a level of functionality so that, it could be an additional benefit. I think we've always thought of it as just another tool and can't replace the other existing tools. And so for the hard-to-reach populations, public health will still be doing the very, as rapid as possible, the contact tracing and individual contact tracing that's required. But, the pandemic is showing the sort of disparities in the pandemic itself and the accessibility to measures more broadly. So that's a wider societal issue. And I think some of the supports provided to more disadvantaged populations are really, really important. But needless to say, this is one layer, but it's not the only layer. So we may have to sort of continue to resort to some of these other measures, like keeping at your entrances to any establishment lists or public health being able to, with everybody's cooperation, show up to be tested, show up to be connected if you've been told that a certain setting has experienced an outbreak. So those traditional means will continue. This adds an additional functionality.
Thank you, Dr. Tam. Next question in the room.
Hi, Tom Parry with CBC. Dr. Bonnie Henry out in BC is saying that she's having a hard time getting reliable information from airlines to try and do contact tracing. I'm wondering if you're hearing that from other provinces, how big an issue this is, and I guess how much harder it makes it. And is there anything you can do about it, the federal government?
Yes, so I think what Dr. Henry is referring to is that getting what we call plain manifest has always been a challenge. And depending on the airline, some of it is missing all sorts of information so that you can't actually reach the persons in certain seats, if they stayed in the right seats, that is. So I think there's been a number of enhancements that would be helpful. One is, of course, the ability for us now to collect contact information from arriving international passengers, and the use of the ArriveCan app. I think if we can have everybody use that app, it would become easier, I think, for us to be able to ascertain what flight individuals have been on. But it is an area that other departments, such as Transport Canada, are sort of working through as well. Which is why, as a sort of, at the beginning of the epidemic, there was an effort to trace contacts, which was quite difficult, and we didn't have any yield. There wasn't an actual transmission event that we could detect on a plane. So the public health energy turned to managing the outbreaks domestically. Very few of our cases actually come from travelers at the moment. But now that our case numbers have gone down, there's been more interest in, well, why don't we follow some of these planes and see if there's been, any contacts at all that's been exposed or transmitted. But all I can say is we haven't got a reported case of transmission in flight. But I do think there's an opportunity going forward to maybe look at that in a new concerted way. And so if with the provinces, right now, what we're doing is just putting up a list of flights with a positive case on it. Whether you've been exposed doesn't mean that transmission has occurred or that has led to a spread in the community. But I do think that more effort in looking at how we best get that contact information could at least help us evaluate the data better going forward. So I think we are in the process of looking at how we better do that.
Just in terms of, you were talking about before about a vaccine not being a silver bullet and this being kind of a multi-year process. Psychologically, how do you think Canadians should be preparing for the future, for, thinking about kids going off to school or people trying to plan a wedding or things like that? What do Canadians have to keep in mind as we look ahead to the coming years?
Well, I think collectively the sort of public health system is trying to look at, well, what are the sustainable ways that we can adjust our daily lives that can just keep going? So some of the more sustainable measures we keep messaging to Canadians in terms of as much as possible that physical distancing, don't go in crowds, maintain the number of contacts as small as you can, hand hygiene, but also more and more trying to convey the concept, what we call the 3 Cs, closed environments, crowded environments, and if you're close face-to-face contact with someone and speaking to them, we need to adapt so that especially high-risk people should avoid those sort of settings or to adapt those settings to reduce the risk. So you're seeing whether it's schools, whether it's universities, whether it's pubs, are trying to adapt so that we can just keep going without sort of escalating the transmission risk. And this concept is to keep the epidemic suppressed in a sort of slow burn and stop any kind of resurgences. So we may expect to message to Canadians that these things, and wearing a mask, by the way, and we just talked about, then becomes part of your daily routine. As you go out the door, you have your hand sanitizer, you have a mask. If you go into a closed space, you're going to put it on. If you can't distance yourself, can't predict, you're going to do that. And so that kind of behavioral change doesn't come overnight. But what I think we're all heartened by is that the majority of Canadians are following public health advice. And kids can be taught so that we begin to continue in this sort of adapted way of living. And so I think that's at least one aspect, while we still researching treatments, vaccines, better diagnostics. So better diagnostics might help us in certain ways of returning back to normal a little bit more. The question about is the 14-day quarantine a concrete thing? Well, we'll keep reevaluating it. Right now is the most reliable method. Is there an ability where we can test people during the quarantine period to adapt that quarantine period? That is under active evaluation, but it's still not as certain as that 14 days. So I think, again, I think we ask for patience, ask for compassion as we try and get populations adapt. And there is no other way. Perseverance and patience. Keep going. Learn your routines.
Thank you, doctors. Ian Woods will take your last question.
Ian Woods, CTV News. Dr. Tam, there's been some reports that workers, migrant farm workers in southern Ontario, have been asked by their employers to basically stay in place and not leave their quarters. Does public health need to take any action against the living conditions that these workers are living in? Reason being, many of them are in bunkhouses, shared sleeping quarters, trailers, in very confined cases. And before, it's already been said that, in an ideal world, they would have an individual living quarters and washroom and that. Granted, the living conditions now, are these things that need to be shut down or looked at further?
I think that's really, really important. We know, based on what we've learned, that these enclosed, crowded conditions are how this virus can spread very readily, and that we must support workers in order to work safely, to support them if they're sick, and to support them if they do need to be in quarantine. But the most important thing is actually prevention, which actually means changing the actual living environment so that they're not such high risk. And I believe it was only last week that Minister Qualtrough had provided some announcements about further support to temporary foreign workers, just to improve these conditions and also support non-governmental organizations that are trying to help these workers. So I think those are the kind of things that are all moving in the right direction. But the bottom line to your question is, yes, we have to do better. And public health issues also involves what we call social determinants of health and living and housing. And so it is part of public health's role to outreach to other sectors who can actually help improve those conditions.
But does public health need to intervene in these situations where migrant workers are put at greater risk because of their close proximity and not ideal living conditions? That's my follow-up, though, if you don't mind responding to that as well. Dr. New, I know you've spoken French at length about schools and masks and that. Perhaps both of you want to just go over again. What exactly is Health Canada's guideline regarding the use of masks in schools, how children should interact, different ages? Because it seems that each province is making different rules and regulations, Yet, kids are pretty much the same and they transmit the same or don't, regardless of whether they're in Ontario or Alberta or Prince Edward Island.
So Dr. New did it in French, so maybe I'll go first in terms of answering in English. So, reopening of schools is one of the most really busy areas of planning right now because of where we're at in the school year. And public health, as well as school boards, parents, are engaged at the local levels in looking at what is the safest way of returning to school, because schools are important to children. So I think, our recommendation, and this is in collaboration with province and territory, would say that non-medical masks plays a role in reducing transmission of COVID-19 in the school environment. So wearing these masks is an additional personal layer of protection, and that they should be recommended as such to help prevent transmission in that setting. We are still learning about the role of children in transmission, but as Dr. New has said, more and more is now known that in fact older children over the age of 10 transmits as well as an adult. Younger kids, even if they transmit at a lower likelihood, they still can transmit. So I do believe that, in recommending the safest way to open schools, masks they play a role. They're not the singular role. You have to have layers of protection, but it's added on top of the hierarchy of controls. What we call that is arrange your school environment physically and otherwise so that physical distancing can happen. Ensure that the number of contacts children and teachers have is minimized so that you can put kids in the small groups that only interact with each other. There seems some really innovative educational approaches that I believe you will see coming out, where older kids can, instead of doing, physics 1 hour, chemistry another hour, something else, is that they will be grouped so that you can have 2 weeks of learning in this same group for a topic and then switch to another one, so that you're not bouncing around all day and have different teachers that have to sort of mix with you. So minimizing mixing and the number of contacts is one very important approach, as well as all the hygienic hand hygiene measures. We're also looking more now at the role of ventilation. So open the windows if you can, go outside if you can, but what can be easily adjusted in terms of looking at that as well. Physical barriers that might be helpful. All the signs, indications that you see in offices now will be in schools at helping kids maintain those distances and practices. So it is a very multi-layered approach, but it should be in line with what's recommended in the general setting as well. So, it's an indoor enclosed environment. So I think masks play a role, and it should be aligned with the child's developmental capabilities, but I think that it's an important additional layer of protection.
So, but just on masks, though, specifically, there was a lot when the pandemic first started, there was a lot of back and forth about the efficacy of wearing a mask, ultimately resulting in now we wear them when we're inside in closed spaces, can't social distance. So children in a classroom, regardless of their age, should they wear a mask from kindergarten up to age 10 and beyond? There seems to be still a bit of confusion on that.
So I think the recommendation is that if you're older kids, it's an added layer of protection. I think schools should recommend it. Younger kids develop, mentally speaking, it needs to be adjusted to their ability to wear it. But as Dr. New says, so I think that in elementary schools, and taking into account that, maybe this age group transmit less, we still don't know actually, let's make sure that we keep collecting the data, then maybe more adapted to the children's ability, and But also, if someone wants to wear a mask and they're young, let them. Don't stigmatizing them. Don't single them out in any specific way. It is an added layer of protection that any child should be able to wear as well. Of course, the protection of teachers are very important, and they are older people, of course, adults, more susceptible to a perhaps severe illness. So we have to protect the staff, whether it's physical barriers, masks, etc. And maybe people with underlying medical conditions need actual personal protective equipment. So that has to be evaluated at an individual level as well.
Martin from Radio-Canada. Sorry, it's my first day. So just to clarify, because we didn't get quite the same answer in French and English regarding masks in school, are you recommending that in schools, students over the age of 10 wear masks across the country? Si on peut avoir la réponse en français aussi.
Could we also get that answer repeated in French?
C'est difficile parce qu'en fin de compte, on sait que c'est la responsabilité pour l'éducation, aussi pour les livres exemples des services de soins de santé et santé publique, c'est avec les provinces et territoires. Nous autres, à l'échelle fédérale, on discute toujours avec nos homologues des provinces et territoires, mais en fin de compte, c'est leur propre décision. Ce que je vois au Québec, on a, comme dit, c'est obligatoire pour un couvre-visage dans tous les espaces à l'intérieur. Je pense à part de l'âge de 12 ans ou 10 ans? 12 ans, je pense. 12 ans. Donc, je pense aussi avec l'élaboration avec l'ouverture des écoles, je pense, d'après moi, c'est le même principe. C'est comme Dr. Tam et moi avons déjà constaté, c'est une autre couche de protection. C'est une mesure de santé publique vraiment efficace à l'échelle de la population. Ça ne coûte pas cher. C'est pas mal facile à implanter. Mais la question, c'est oui, je pense qu'en général, oui. Mais c'est toujours une question, OK, est-ce qu'on dit pour tous les enfants? Est-ce que c'est un outil plus efficace pour les enfants plus âgés, à part de 10 ans, et peut-être pas pour les jeunes, parce que moi, j'ai déjà dit aussi que moi, je ne suis pas un expert, mais moi, je comprends pour les jeunes enfants, l'éducation, c'est un aspect important avec les enseignants, c'est l'interaction, les expressions faciales, tout ça. Les autres aspects, peut-être, moi, je ne comprends pas exactement, mais c'est ça aussi un aspect important. Et si on couvre le visage, c'est peut-être que c'est un impédiment, quelque chose qui peut empêcher la formation aussi, l'éducation des enfants. Donc, c'est toutes les autres facteurs aussi en considération. Et en fin de compte, ce n'est pas seulement les masques, comme Dr. Tam on dit, c'est seulement un aspect. C'est aussi qu'est-ce qui est possible pour la distanciation physique, aussi peut-être pour les barrières physiques, aussi bonne disponibilité pour l'accès, pour se laver les mains fréquemment. Il y a toutes sortes d'autres choses aussi, mais c'est sûr que le port d'une couvre-visage ou un masque non médical, c'est aussi, je pense, un important composant, on peut dire, d'une approche compréhensive.
Maybe juste pour simplifier la réponse.
Just to simplify the answer,
on va publier la ligne directrice cette semaine très rapidement. Ça inclut les recommandations pour les masques aussi. En général, la recommandation est que pour les enfants plus de 10 ans, c'est une recommandation de porter les masques. Pour les enfants plus jeunes que 10 ans, c'est une considération selon les compétences, les autres considérations pour les jeunes enfants. But we're a little ahead of the guidance, but that's the sort of bottom line. But can I just say that as all Canadians have seen, that the recommendations for masks will undergo evolution as the evidence changes. And we will also have to see what happens as we understand transmission in different age groups and what happens in schools. And please expect, we must well just forewarn people that we may have to adapt this recommendation as we go along. Thank you.
Okay. Thank you, Dr. Reporter. Just a quick reminder that in the future it is one question and one follow-up. So that concludes today's press conference. Thank you.
Thank you. Merci.